Good morning. This is Dr. Saeed Al Nasser. This very brief talk is about coronal knee alignment in children, or what we call genovarus and genovalgus. The reason for this presentation is that this is a very common complaint in the orthopedic clinic by the parents. Very often the parents bring their children to the clinic because they are concerned that the child has a bowing of the legs, or what we call genovarus, and sometimes the child will have knocked knees, or what we call genovalgus, and the parents are very concerned that this is pathological. The truth is that most cases are physiological, and this is normal in children. Children development goes through phases in regards to the alignment of the knees. They are born with the varus alignment of the knees. This becomes apparent to the parents when the child starts walking at around 1 year of age, and then they will seek medical advice. At about 18 to 24 months of age, the knees become straight, and after that the valgus deformity starts to appear, and it becomes apparent at about 3 to 4 years of age, and then the alignment will go back to normal by the age of 7, and then it will remain stable after that. So please watch the video in the next slide, and this will explain things further. As you know by now, the age is very important when it comes to assessing these children with genovarus and genovalgus. It is important to examine the child to check for which deformity he or she has, and then you will need to use the curve, the Selenius curve, to know whether this is physiological or not. For example, a 1-year-old with genovarus is normal. However, a 1-year-old with genovalgus is not and needs investigations. On the other hand, a 5-year-old or a 4-year-old with genovalgus is considered normal, but a 4-year-old with genovarus is not and needs to be investigated. Also, if you find, for example, let's say a 1 year and 10-month-old child with significant genovarus, then this is not usual, because at this age the knees should be straight or near straight. So if he has significant varus, then this may need to be investigated. When we say investigations, the main thing to look for is rickets, as this is the most common cause for coronal deformities of the lower limbs. Rickets can cause both genovarus and genovalgus. So this will need to be looked for. You will need to know the clinical signs of rickets and also the investigations required. This is covered in the pediatric rotation, but you may be asked about them in the orthopedic exams as well. Basically, you look for the following signs: genovarus or valgus, rachitic rosary of the ribs, widening of the wrist joints, and craniotapes. You will need to read about these signs to be able to find them clinically. Also, investigation-wise, you will need the lab tests The most important is vitamin D and the alkaline phosphatase. As you know, rickets has different types. The most common type is nutritional rickets caused by vitamin D deficiency. In this case, you will find that the vitamin D level is low and the alkaline phosphatase is high. There are other types of rickets that you will need to know about as well. Going back to our initial point, the most important thing is to be able to differentiate between physiological genovirus and valgus and between pathological ones. More than 90% of these cases that present to the clinics have physiological genovirus or genovalgus. So you should be able to detect that and reassure the parents. If you have any further questions about this topic, we can discuss them further in the clinical sessions.